agenda looked loaded. Hopefully it's quick stuff.
A lot of it's health department stuff. Okay, it is Tuesday, August 30th, 2022. We'll call the meeting to order. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, you've been gone for so many days, so do you have any minutes and reports received and filed?
I do not have it.
Okay, Commissioner Committee, liaison reports, upcoming meetings and events.
Thursday morning, Cole County Communities. Going to go to a first responders meeting Thursday night. Eastside Business Association, I think, is Friday. I don't remember seeing an email on it. And then Monday is Labor Day. I think that's about it.
I have a meeting this afternoon along with Debbie, and our auditor's going to sit in on it with Wall Street Group,
Yes.
recap the insurance claims, coverages, and projections for the county. Tomorrow, I'm going to meet with the Jefferson City Public School new superintendent tomorrow, and Cole County Communities on Thursday morning. And then Sunday, there's a Patriot Sunday First Responders event at American Legion.
From 4 to 7 p.m. So all of your people go out and eat. Yeah, the only thing I've got different is Wednesday night, I think, United Way campaign kickoff from 4 to 6 at Capitol Bluffs, yeah. So, and that's all I've got. Okay, presentation from staff, consultants, and invited guests. And these are our invited guests from Strikers, so.
Morning.
You're up, we don't fool around.
You guys do
God,
not
you know.
mess around.
Where?
Hey, good morning.
Morning.
As we all know, we've been working on budget pretty heavily for the last month or so, and as I was working through budget, looking at capital items and trying to do some long-term fiscal planning, it became evident that over the next few years, we're going to have to make several large capital purchases to continue to maintain a high level of medical service equipment. Just in analyzing that piece of it, it became evident that there has to be a better way for us to do business, something that's more cost effective, something that we don't basically end up with a bunch of medical equipment that's at the end of its life and doesn't have any real value that we've been owning and paying on for a couple of years. So I engaged our rep, Christina from Stryker, and just said there has to be a better way to do this, and thankfully she said, why, yes, we do have a better way to do things. So that led to a conversation with some other folks at Stryker, Chris and Christina here this morning to give you a little bit of presentation about what we feel is the best way to move forward with our capital medical equipment. So I'll turn it over to them.
Excellent. Good morning. Like
Morning.
Chief said, my name is Chris Van Aken. I'm the Regional Manager for Stryker Emergency Care. For the part of the business that covers Missouri, this is my colleague Christina. We appreciate you giving us the opportunity to present to you today. If I were in your seat, I think the first question I would have is, why? Why a program like ALS 360? How can a community like Cole County benefit from it? And I think my answer to that would be it's really a function of how EMS has changed over the last 20 years. If you look at an ambulance and how it was equipped 20 years ago, all the capital equipment that was used in the back of the ambulance would probably cost a community like Cole County about $9,000. And although that price tag was really desirable, the results that you got from that was not desirable. All of the equipment was manual, the patient handling equipment was manual, which resulted in a lot of injuries to caregivers and their patients. And the treatment equipment didn't have the technology that the equipment has today. It wasn't able to provide the interventions that we're able to provide today. So quite frankly, a lot of people were dying 20 years ago that are being saved today. So let's flash forward into 2022. The good news is now we have that equipment that makes patient transport safer, reduces injuries, and allows our caregivers to save more lives, but there's a price tag that's associated with that, and sometimes that price tag can be pretty big. What that results in is a situation where our EMS leaders are going to our community leaders on a regular basis and asking them to spike the budgets for this capital equipment. And although that's really hard for the EMS leaders, that's even more difficult for you, because how do you plan for a budget like this? How do you budget for that? How do you anticipate that? And so with a program like ALS 360, what the goal is to take that capital spend and smooth it out to create an operational spend over time that you can plan for, anticipate, and budget for. So that's really the ALS 360 program through Stryker. In a nutshell, what it allows you to do is get all the equipment that you need today up front. It includes all the ProCare service on it, so there's no costs that are going to pop up over the next 10 years that are surprise or unanticipated. And when Stryker launches a next generation piece of equipment, a device that allows you to save more lives, or a device that allows you to transport patients safer, you automatically get to upgrade to that new equipment at no additional cost. It's built in to the program. So in a moment, I'll go into the number slides, but before I do, I wanted just to kind of go through the equipment that's part of this proposal. Now you'll see at the top of the slide something called the expected service life. When you're a medical device manufacturer like Stryker, you're regulated by the FDA. And anytime you develop a product, you have to express to the FDA its expected service life. And in a nutshell, all that really means is we have tested it under normal use conditions to last about this amount of time. That doesn't mean that at the end of that expected service life, the device is going to self-destruct. But what it does mean is there's some risk for communities to continue to use those devices past that expected service life. The first device here you see is the StairPro stair chair. That's the track stair chair that allows you to take a patient up to 500 pounds down a flight of stairs without putting any strain on your back or shoulders. You have the county has 11. 10 of those are well past their expected service life and should probably be replaced soon. The next device is the Lucas mechanical CPR device. Manual CPR is really, really difficult to do, especially for long periods of time. Lucas allows you to quite frankly save more lives. You have 11 of them. 10 of those are really close to being at their expected service life and are close to probably needing to be replaced. The next device is a PowerPro cot. That's the cot in the back of the ambulances that goes up and down with the push of a button. You have 11 that are 5 years old, but the picture you see there on the screen is our PowerPro 2. You have the PowerPro XT. We recently launched the PowerPro 2 cot, which has technology in it that make patient transport even safer. The Power Load device is the device that's installed in the floor of the ambulance. It allows you to lift and load a patient up to 700 pounds without putting any strain on your back or shoulders. Again, you guys have 14 of them that are 5 years old, but in 2019, Stryker launched a newer version that makes it even safer. You guys have the older version. And finally, the McGrath video laryngoscope. This is a device that allows paramedics to more easily intubate a patient. The McGraths that you have now are only 2 years old, but McGrath just launched a new device that you see on the screen with enhanced technology and graphics that gives paramedics a better chance of that first pass intubation, which is really what the goal is, to try to save more lives. So that's the equipment that's part of this proposal. You see here on this slide, 14 Power Loads, 14 Power Pros, 14 StairPros, 13 Lucas devices, and 14 McGraths. But again, this is a 10-year program, so what that really ends up being is over 10 years, 28 Power Loads, 28 Power Pros, 28 stair chairs, and 26 Lucas devices. Again, on the right-hand side, you'll see all this equipment is covered by that service contract. We come out once a year, we PM it, we fix anything that's broken, and if anything breaks within the year, we're going to come out and we're going to fix it at no additional cost.
Chief, did you have something you wanted to say?
Yeah, I think the big thing that we want to point out on that slide is currently for most of the capital medical equipment that we have, we only have 11 sets. So that means that 3 of the ambulances that we have are just shells as a vehicle. What we've asked Stryker to do is come up with a proposal that allows us to outfit all of our ambulances with the medical equipment, the capital medical equipment that we need which also allows us to transfer into those vehicles a lot more efficiently. Crews don't have to move all of their equipment from one to the other. And in a time of disaster, it allows us to fully deploy those ambulances and use our full 14 that we have in the fleet instead of just 11. So, sorry, Chris, I didn't want to.
I didn't
Yeah.
realize we were getting the Lucas from you, from Stryker. But yeah, I think we bought those back under Mike Shirts originally. So yeah, we've had the Lucas for quite a while.
Yep, yep.
And I don't think that we explained the refresh portion of it yet.
Yep, we'll get to that. Yep.
Okay,
So,
yeah.
yep, so for all of that, again, the cost associated with the LS 360 program is there on the right, roughly $2.8 million in capital equipment over 10 years, $7,100 in data over 10 years, $700,000 roughly in the service. For the equipment that you currently have, we're providing a trade-in value that you see there of $155,000. And that all rolls up to roughly $3.46 million over 10 years, or $346,000 a year over 10 years, or a year over 10 years. Now, that middle column, a lot of times when we're presenting to individuals like yourself, we're asked to provide some type of apples-to-apples comparison. What would it cost this community if we were to purchase all that equipment over 10 years? And this is our best attempt to give you that information. Again, we would argue that it's a little bit conservative because those prices there are based on what we think it's going to cost us to build some of this equipment 5, 6, 7, 8 years from now. But you know, inflation is sky high. Interest rates are continuing to rise. The supply chain challenges that are hitting all manufacturers like Stryker are causing these prices to go up. So the likelihood is that that number is a little bit conservative. But what I can say is that it would cost at least $4.2 million over the next 10 years to purchase that equipment. And this slide kind of highlights everything that we've already talked about. So again, $346,000 a year for a projected savings to the community of $850,000. That was the difference between the two numbers we saw on the previous slide. And again, our goal is to try to smooth out those capital spends and create a nice, predictable operational spend for the county.
Quick question, Chris.
Yes.
The previous slide, I'm always interested when I see numbers, curious at times. Trade-in value, is there some reason it wasn't 154.5 versus 150?
No,
Okay.
MSRP.
yeah.
I thought maybe there was some threshold you couldn't go past, or?
No.
Okay,
no.
all right.
I wish I had a good story behind that. If I was smart, I probably would have rounded it up.
Just curious, that's all.
All right. So that slide, and then this final slide here, you know, Stryker's not naive. We know that $3.4 million is a lot of money over 10 years. Even when you break it out once a year, $346,000, that's still a lot of money. But I like looking at it as a cost per day perspective, right? Cost per day, that $346,000 divided by 365 days a year, it's $948 a day to provide the members of this community and the crews that service them all of this life-saving and patient handling equipment. And $948 is a lot of money, but your first ALS transport a day is easily going to cover that. Your first 2 or 3 Medicare, Medicaid transports a day are probably going to cover that as well. So I do want to just kind of highlight, because I skipped over it a little bit, the program, you get all the equipment today. If Stryker launches a next generation device over the next 10 years, we refresh to that at no additional cost. So again, the community gets the benefit of that brand new technology. If we have a device that we don't launch a brand new version of within the next 4 or 5 years, then what we do is we take the current device that you're using and replace it with a brand new one that's just like it. So you are essentially refreshing all of this equipment one time throughout the 10 years. The real value, though, is to be able to capitalize on that next generation equipment when it launches.
So including cots and everything like that?
COTS, power load, everything that was part of that program. Yep,
Okay.
that was on these slides.
Okay.
So I think some of the highlights that I want to point out is that with our current arrangement, you know, we purchased ambulance cots 5 years ago. We did a lease-to-own plan where we paid for those cots over a 5-year period. So currently, with maintenance, that's costing us roughly $150,000 per year just to buy those cots on that 5-year plan. Unfortunately, those cots, as we know, have a service life of 7 years. So there's not a lot of period where we own those cots outright before we have to start the process all over again. As a county agency, I don't know how we say that, a cot has a 7-year service life, but we're gonna extend past that. I just don't know how we, with the tax base, turn to the citizens and say, we're gonna give you equipment that's past the end of its service life. So with those two things in mind, it's really about how do we ensure that we're spending money most efficiently. And in my opinion, it doesn't make sense to buy something that has a 7-year service life when we can, make sure that we're always refreshing that equipment on a 5-year cycle with this sort of program. I know it's a lot of money, but again, we've built into our budget that $150,000 for the last 5 years. It's not an issue. I did balance this year's budget at the new amount of $346,000 in case we wanted to go down that road. I've also talked with finance and the auditor, who haven't raised any red flags. What we're asking for today, this program is a sole source program. There is nothing else out there like it. What we'd like to do today is get approval to run the sole source ad and continue conversations with Stryker. The one thing that they have relayed to us is that there is a price increase coming October 1. Certainly we can continue discussions as necessary, but if we do sign before October 1, that'd be a savings of over $40,000 over that 10-year period. The good thing that this program does is it locks in pricing on today's valuation. So over that 10-year period, we don't have to worry about inflation or other market costs affecting our equipment either. There is no renegotiation. The contract is subject to appropriation, so if for some reason we came into financial difficulty, we have that out as well. So asking for approval of the sole source today, that's my request. I'm sure these folks would love to answer any questions that you have about the program.
So the 150,000 that you have in your budget, that's just for the cots?
Correct.
That's not for the, that's not for any of the other equipment, the Lucas or, so we're getting, we're paying more, but we're covering more.
Right.
Is this a 1 year, one payment a year, or is it 12 payments a year?
1 payment a year.
1 payment a year, and it comes in whenever we pull the trigger?
Yep, the first payment would be due when the last device delivers. So we could make that work however you wanted to. I think right now most of our devices have between an 8 to 10 week lead time. So if we got the thumbs up, then 8 to 10 weeks from now it's being delivered. That's when the first invoice is due. However, if we wanted to push that out further into next year, then we could kind of work around what makes the most sense for the community.
And that is my plan. If we wanted to go down this road, all we would have to do is sign the agreement before October 1 to realize the cost savings. However, I would not take delivery on those items until 23 so that it does fit in the 23 budget. So I'm not asking to spend money out of contingency or anything like that. It would just be built into next year's budget for us.
And is it, where, are we installing new tracks in each ambulance as well? Or,
Yep, so my understanding is that when you order a new ambulance today, it's coming with that track already installed, the floor plate. And then as part of the program, our ProCare technicians bring the rest of the power load unit and install it on top of the floor plate.
okay, the ambulances we've got, do you come to us and install those, or do we take ambulances out of service?
No, as long as those floor plates are installed, which when I talked to Chief Hoy, all of your ambulances are being delivered with those floor plates, so that's not an issue. We come to you and install it from that point on.
Okay.
And if you get a new ambulance, we'll take it out of that old ambulance and put it into the new ambulance again as part of this program.
Okay. I just don't want ambulances out of
Yep.
commission because we're,
Yep.
okay.
I'm fine with the sole source. I want to sit down with our budget numbers and see what we're using each year, see what they come up to compared to what you had. I know that we're trying to do this pretty quick, but the sole source, we're not tied into having to do
Correct.
it. There's a lot of people end up with timeshares when you rush them into those kind of things, so.
Right.
Did you,
no, no,
did you
that's-
get caught on one of
I was
those?
gonna ask, is there some experience there, Jeff?
No, I couldn't get out of that meeting fast enough. We were on a beach.
That was the piece. We definitely didn't want to come up here and make a one-time pressure pitch. All we're asking is to proceed with the sole source.
It
so
sounds
that-
great. So, Yeah, I'm good with this.
I'm fine with that, so whatever it takes to
Yeah, we'll just
proceed.
ask a motion to run the sole source with Stryker ALS 360.
Is Mark in here? Mark?
Mark is listening
Okay.
to a
Well,
webinar.
That is something we can kind of task him with, if he can maybe throw some numbers together and just.
Okay, but I'll make the motion to run the sole source, get that going.
Second.
All in favor?
Aye.
Aye.
Thank you very much.
Thank you.
Thank you.
We
Thanks,
have some,
Chris.
Chris.
Handouts here.
Thank you very much.
Easy to remember your
Okay.
names like that.
We did that on purpose.
Appreciate it.
That's it. Thank you. Who else? Yes. It's like, I brought a lot of copies, just in case.
Thank you. Give one to our
Thanks, sir.
newspaper,
Okay.
our Ace Reporter.
Okay.
Ace Reporter, you like that? You like that? Ace Reporter.
Did you get one?
Okay.
Thank y'all.
We will keep
Thanks,
moving
Julia.
on. Bids and contracts. Approval and signing of WIC contracts from MODHSS.
I feel this is welcome to the Christy Campbell Show. I have several things on the
I know.
agenda today. We'll start with the WIC contract. This is our annual renewal of the WIC contract. They're on the federal fiscal year, so it runs October to September. And as we've kind of talked about before, and when I sent the email, thankfully, DHS is changing how they fund the WIC contract. It used to be a certain amount per WIC participant. So it was like, you get $1,500 per participant, you figure out how to spend it, this is your budget, that's it. Now they, especially since we have kind of a model program in the state, they're saying, how much does it cost to fully fund an adequate exemplary WIC program? So we've gone back, and for years these staff didn't get raises because we were capped at that amount. So we went back. Melinda did a lot of analysis of what other WIC agencies were paying their staff, and I sent an email, but I also have a handout if you want it. So with this new contract, we would like to increase the salaries for the WIC staff at no cost to the county. The WIC contract covers all of their salaries and benefits. So in addition to signing the contract, I would like for you to approve the increases. Do you want to see the handout, or it was in the email? This just has positions. So I put a column that'll be kind of the new salary for people when they start, and then I have the current salary, and then the proposed. So do you have any questions? And Melinda can answer. She did a lot of analysis with comparable counties on what they were paying staff, but we're thankful that the WIC contract and the auditor has
So
looked
when
at
we,
it.
just clarify again, so when we had a COLA raise, they didn't necessarily get it.
They
It was just-
did, and Melinda went back and asked for more money, and that was the amendment that we just did a couple weeks ago. So
Okay.
when we gave them more money, she went back and told them, hey, we need more money, and they gave it to us. Because it's kind of been in the last year that they've changed their process. So
Okay.
again, all covered by DHSS. And the raises for them would start October 1 when the new contract starts. They would not start immediately.
Okay.
So do they get a COLA raise again if we do a COLA raise at the end of the year and then we have to ask for more money, or is this basically their?
My proposal is
Raise.
that they would get that COLA, and then we go back and ask DHSS for more money.
If DHSS does not give it to us, then do they get more money or not?
I guess we could cross that road, but so far DHSS has been very accommodating and been able to allocate more money. And I don't know if you want to build on that, if you've talked to them about that.
Right, and they've told me that anytime I feel like we need additional funding for enhancements in the rooms that
We just did that too.
the clinic rooms, then it's
Okay.
not an issue, they would do a budget adjustment. And that there's always money that the regional office is available to clinics and agencies. You just have to do a budget adjustment to request that.
Yeah, they must be working with a lot of the counties, because Osage County and is enhancing their WIC office.
And, you know, they
So-
have some counties that don't spend all their money. Anytime there's a staff vacancy, then that's money that's not spent. So at the state level, they have more to work with. So that is our proposal, is we would always make sure that this program is 100% funded by DHSS, no cost to the county.
And
They even provide the
They
computers.
provide everything, our computers, our printers, the health assessment, the length board, weight, everything, hemoglobin machine, supplies, Band-Aids. There's nothing that the county.
I'm fine.
Hard to say no to free money, isn't it?
Yeah.
And it's a
Well,
very deserving
And it's
program.
based on salary studies. I looked at 3 different sources, and it was very well thought out. And
Yeah, and we compared it to the other managers in the department and other staff in the department. It's really bringing them up to where some of the other staff are. We're not creating issues within our department.
So each county is each county around us facing this same question now?
Well, I
They are,
guess
and-
Boone County does a study every 5 years and, right, 5 years?
Yeah.
And then they try to look, they have several, it seems like they have problems keeping staff past 5 years. They come and get experience, then they leave. So we even looked at their salaries. They're trying to, their median salary is about where might be a little bit less even than their median, because they're trying to pay people more because they can't keep staff. So, and it just depends. Like in several other counties, their WIC nurses also do the other programs, because they don't offer WIC every day. We offer WIC every day, and that's why we have a lot of people that come from other counties to receive our WIC services. So, long story short, yes, all agencies are facing issues with staffing, but they also do have this money available that they could get from the state.
I guess where I was going with that leading question is, if we say, no thanks, our WIC people might look to an adjoining county and say,
Or-
why
or
won't
the
I go
state-
there?
The state is, we lost another nurse last week, and yeah, they're going to job with, additional money. So, right, we're always competing with other agencies.
Osage County is saying this will increase their WIC clients. We were doing like 1,400, somewhere in there,
per month, yes.
per month,
Are
like
we still doing
1,400. I
that?
mean,
Yeah, we're-
we've got to be one of the larger,
Like I said, we pull from other counties because we offer it every day.
yeah.
And Columbia Boone is a very good example to look at how they're paying their staff, because they did hire a company to evaluate their positions. They started 5 years ago, and they reevaluate those positions in the county and city on a rotating 3-year cycle. And so when I look at those every year, they're being paid in their WIC agency. They're doing the exact same things that we are doing, and they're being paid significantly more. So it would be easy enough for our staff to say, well, I'll just drive down the road. There's a position open there, and I'm gonna do that. So
Maybe this was already mentioned and I was drifting off to look at numbers, but what, we have every time we do a $1 raise, it really costs us $1.20 or something, or I don't know.
Because of benefits.
Yeah.
They cover all the benefits too.
Okay.
And like I said, all the supplies. When we wanted
very
to
good.
get some different workstations in the rooms to create some distance between clients and staff, they paid for all that. It really,
and they paid almost $100,000 when we moved into our new facility to cover part of the parking lot, to provide
Waiting room.
chairs. Anytime there's been something we've needed to do, but when we moved into the new building, they provided a lot of funding to help us to do what we did over there.
and then we helped them out because we're here in town and they wanted to pilot the new EBT card, so they come to us first. We have a very good relationship with DHSS and their WIC program. We pilot a lot of projects for them.
Can they get money for the rest of our employees?
Do they want to do WIC services?
I mean, if
I'm
they're,
willing to try.
No, I think this
if
is,
they want more, they can go work for the WIC services program, but I'm just where they at with, other money, because we do provide a lot of other services, not just a WIC service, so it'd be nice
Other-
if they'd be able to try to keep up there too, and
Well,
our nurses.
yeah.
And
I know this is a little bit different because this money comes from USDA, other other programs have different funding sources from the federal level. So
Yeah.
we try to get every contract and grant we can from DHSS, you know, but some of that money is so siloed. Like this, it's only for WIC, you know, it's like that crisis co-ed contract that we're still fighting with the $128,000 that has to be spent by March. We're trying to get them to approve a driveway. You know, so much of the funding from the federal and state level is siloed for a specific program. It makes it difficult.
I'm just looking at, I mean, this is in the middle of the year because of their budget year and trying to figure out with all the COLA raises and stuff too, if there was ways to free up other money to take care of the other employees. Cause it's a nice little raise for them, so, I mean, I'm
We
happy
can
to be able
address
to do
the
it.
other employees at budget time, don't worry.
No,
I know, but it goes to
Yeah.
these too.
Yeah.
So if
And then
there's
we
a
would go
ten
back and
percent
ask for
raise,
more.
then we do another 4% at the end of the year, you know, where some of our employees are getting 4 and these essentially are getting 14. So we need to find more grants.
Well, this is a win-win, so if we don't do this, we're stupid. We're idiots.
It just, I'll just keep my mouth shut.
Well, I'm just
Unless
saying
you
that
ask.
if we do this, I don't have a problem doing this, but at the end of the year when we do budget and we pass on raises, they're getting this raise plus that raise. And this is, it's still gonna be covered by the grant, so it's hard to say no to that too. So why punish them just because we can't get more for the other ones?
So you want to turn this down?
So, did I say that?
Well, and I think.
I didn't even say anything close to that.
I
I
said
said,
they-
no, we need to do this. I was talking about the
Okay.
raises.
Melinda
Okay.
also pointed out that when previous directors there in previous years, a long time ago, the WIC staff did not get raises when other staff did because there was no money in the WIC program, but that was kind of before my time.
Yeah,
Melinda started at the WIC
there's
program,
always
she was
been
like
this
10.
is your money, this is what you have to work with, we're not gonna subsidize that. So then you have that, you know, I've been here for 24 years. I've seen.
I'm pretty sure that the time I've been here, you guys have gotten the same raise as all the other
Right,
county
But if
employees.
there's been any type of merit raises, or if somebody came and said, I want to pay this position more because of this reason, that really hasn't been an option, because there wasn't additional money for maybe more of a merit raise, or more of a opportunity to reevaluate that position to say, well, how does it compare to another agency down the road that's
Right.
being paid more?
Yeah.
Because it was just, this is how much you got to work with.
Right.
So yes, and I'm grateful for those, you know, COLA raises that we've gotten, and
Yeah.
we're very thankful for that, so.
And that's just it. We have other departments in the county that are funded by certain things, but if you were in a general fund employment, then we treated all the employees the same since we've been here. So, but that's just, you know, we all have the same benefits, we all have the
That's,
same
I mean, it's the
structure.
same angle I'm coming at, but this is something so different because it's all a grant. Even if we give them that raise, they're gonna ask for more money and it's gonna cover it. So it's trying to step back and not think of it that way. I know where you're coming from. It's kind of my thought process too, but I don't think you can punish them if they're gonna keep that program going. Why punish them and tell them we could get more money, but we're not going to. I don't think that's fair to them, so I'm fine with moving with it.
Me too.
So do we need any kind of action, or are you just gonna?
I have a contract.
Oh, the
and I have
contract,
paperwork.
okay.
I'm prepared.
Gosh, Christie.
Make a motion to sign a program services contract with WIC Local Agency Nutrition, or the WIC Local Agency Nutrition Services contract with DHSS.
Second.
All in favor?
Aye.
Aye.
There's no sticky on where to sign on
Oh,
that, Sam, you're
okay.
gonna have to search.
I go down here on the bottom. I do these.
Just sign
Okay.
anywhere.
Is the approval and signing of FY 23-25 CCSI participation, is that you too? Okay, keep going.
So this is for environmental childcare sanitation inspections. This pays for our staff to go out and do inspections in the childcare facilities in the county. We get $120 for each annual inspection. We get $70 for the re-inspections, $30 if it's a special circumstance. So I just ask for you to approve for us to continue that service and get reimbursed for it.
This one's not as complicated, right? All
If
right.
you do the service, we get paid.
I'll make a motion to accept and sign the FY 23-25 CCSI participation agreement.
Second.
All in favor?
Aye.
Aye. Okay. Signing of MOU with Missouri Department of Health and Senior Services for birth and death certificates.
This contract enables us to hit the fraud system to access the birth and death records. It cost us 0.242 cents every time we hit that system. I think birth certificates are $15 each, death certificates are $13 for the first one, 10 after. So I know that it's a good service we provide because DHSS is only doing those by appointment only. So we get a lot of people coming in to get those birth and death records.
This is sort of just a curiosity question. Do you have folks who walk in, they're doing genealogy studies of their family, and they want to know when Grandpa died and that kind of thing? And it's not really related to the health department, but
Right. We have people, I don't know if they're doing that. You know, we have people come in all the time that just need a death certificate. They have to prove their relationship, you know. But they could be using it for genealogy for sure. We had an interesting situation the other day. We had someone who had their loved one in the car, wanted the birth certificate. We took the paper out there because they were too elderly to come in, and then we couldn't help them because our records only go back to 1920, and they were like over 100. So,
wow.
I know we felt
Were
so
you getting your
bad
birth
after all
certificate,
that.
Sam?
We couldn't get it.
I think it must have been Harry.
So-
Harry's a little older than I
But I
am.
imagine some people do come in and request those records for genealogy. Usually it's for insurance or other purposes. We see the funeral home guys a lot.
this is anecdotal, but I've had a constituent or two say that they walk out of a building on Wildwood so upset because they won't talk to him because they didn't have an appointment, and they walked in without an appointment. This is more under the COVID than we have now. And then they go to your place and they get instant service.
DHSS is still only doing by appointment.
Is that right? Yeah.
I found a death certificate for a gentleman who died in Greene County, but was from one of the African countries. And the consulate in Kansas City was trying to get a death certificate so they could send the body back to his home. And DHSS told them it would take 3 to 4 months, and they couldn't do anything. So anyway, with getting a little information, Christy was able to get us that, and I overnighted it to the consulate in Kansas City, and
Yeah, we have a lot of
So
people
it's
come in
your-
very, very upset, and we were able to help them very quickly.
Yeah.
So it's
How
good.
much do we get paid for each?
So
It's like
if it's,
$10.
yeah.
What's DHSS reimburse us per?
Well,
Record.
we pay 0.242 cents to hit that system. And then when the person pays us for the death certificate, we keep the rest of the money.
And we get reimbursed what?
Well, it's $10, yeah,
We
exactly.
get reimbursed
Yeah,
zero
we
for
get
doing their
reimbursed
job.
zero.
So-
We get the rest of the money from the certificate. I mean, they give us the printer and the paper, but yeah, they don't give us any money for that.
Yeah.
the funeral homes are some of your best customers as well.
Okay. We got the, make a motion to sign the MOU between Missouri Department of Health and Senior Services and the Cole County Health Department.
Second?
All in favor?
Aye.
Aye.
Okay, approval and signing of Show Me Healthy Women Services Agreement.
There's
Jason?
two of them there. There's one for JCMG Ancillary Services and one for PC. So the Show Me Healthy Women program is available to women who are uninsured or underinsured. We help with mammograms and other expenses. If we don't have the service they need, JCMG provides the service. We reimburse them the rate that the state pays us. So.
A motion to approve and sign the Show Me Healthy Women Services Agreement with JCMG PC.
Second.
All in favor?
Aye.
Aye. sign that. Okay. That was that.
Are you gonna do those two separate motions for two separate contracts?
Yes, is this the second one? No, no.
Yeah, there's two there.
Oh, I'm sorry.
Oh, okay. So the approval and signing of Show Me Healthy Women's Services Agreement.
That's what we just did.
Yeah, we
didn't-
just, well, there's two of them.
JCMG ancillary and JCMG PC.
PC.
Yeah.
So-
just did the PC.
I'm confused. Is it on the agenda that way?
Yes.
Yeah, it is.
And
There's,
it's just the little box that's checked there. One's like a PC and one's ancillary.
A motion to sign the, excuse me, contract with JCMG Ancillary Services LLC.
Second.
all in favor?
Aye.
Aye. Okay. Approval and signing of contract for child care health consultation program from DESI.
Now, this program used to be in DHSS and now it's moved over to DESI, but it provides reimbursement when our staff go into childcare facilities and they'll teach classes to the kids and sometimes to the providers. We're gonna start doing some CPR for the providers. I'm gonna have an amendment very quickly to the contract that we have now to increase the amount. But this provides funding for Megan to go into those childcare facilities and do the training. We'll do like, they have the hand washing thing with the glow light that shows the kids how well they wash their hands. And we take in sunscreen and toothpaste and just health education items.
Sharing it. All right, I'll make a motion to sign the child care health consultation contract with Missouri Department of Elementary and Secondary Education.
Second.
All in favor?
Aye.
Aye.
Okay. We're just keep going with you. Down at the very bottom of new business is approval of laptops for the health department, ELC ED contract.
So with the ELC expansion contract, we wrote in new laptops for the nurses. Some of them didn't have microphones or cameras, and you know, especially like Chesney and some of the other ones, they do a lot of Zoom interviews or calls, and we want to go ahead and upgrade their laptops. So I put in the contract, we kind of estimated high, $17,500 for the laptops. Brian was able to find them with expanded memory and everything they need for $7,755.37. Chris did discover that the monitors we have are VGA and they won't work with those new laptops. So Brian was able to also get a quote for new monitors, and that was $2,857.12. So that would bring the cost for laptops and monitors to $10,612.49, and those are off of state contract. So still well within that $17,500 that I put into the contract. So we could buy those at no cost to the county, and all our nurses would have new laptops and new monitors.
Makes sense to me. So, yeah, so do you have a contract for that, or just we just need to approve
Brian.
that, or?
There, I don't think there's any contract, right, Brian? It's off state co-op agreement.
I didn't hear what Brian said, I'm sorry. He didn't speak into the microphone.
It's off cooperative procurement.
So no contract.
Okay.
So we don't need any action approving it or anything? You need anything, Debbie, or just we'll give you our blessing since it's in your budget and it's on the,
We give Brian the blessing. He'll do the ordering, right?
so.
Yes.
Yep. I'll pay for it. He does the ordering.
Sounds good to me.
Okay.
Okay.
Yeah.
Thank you very much. That
Thank
concludes
you.
Okay.
Chris Campbell Show.
Do we have any other unfinished business? New business, accounts payable review.
Actually, we have one that I'd like to get paid this time, so I'd ask for approval of accounts payable pending review.
Motion to approve accounts payable pending review.
Second.
All in favor?
Aye.
Aye. Okay. First reading of budget adjustment number 10.
This is for an even $10,000. This is a grant from the county health, from the county clerk's office for the HAVA election security grant. No action today. We'll bring it back up in 10 days.
Okay. First reading of budget adjustment number 11.
This is for an even $4,000. This is the county health department. This is the Children's Care Health Program. And no action today. We'll bring it back up in 10 days.
Okay.
Hey, Debbie, was there a budget adjustment coming for, or was it just a transfer on, that dilapidated vehicle that the sheriff threw off onto the public administrator?
There should be a
I'm right
transfer.
here.
Oh, I'm sorry.
I did 2 transfers.
Oh, those
Give
are,
it back to
we
them.
do those by transfer? Is that instead of budget?
Yeah, budget
Okay.
adjustment's just additional revenue that we've received to offset that expense. We haven't, so it's just a strictly transfer because there's no additional revenue to pay for that.
Mm-hmm.
Was that close enough?
Okay, purchase of new body cams.
I'd like to move this to next Tuesday's agenda. This turned out to be a lot more comprehensive program than what we were anticipating. So I really need to take the time and drill down on some of the amount of money that they're talking about. So if I could, if we could table this to next Tuesday's agenda, I would appreciate it.
Okay. I'm good.
Are we able to, President Biden, I think, put like $38 billion towards law enforcement.
So
Are we able to access any of?
So there's a lot of grants that came down from DPS. They haven't quite pushed it out to us yet on what that's going to entail. I don't foresee that helping us at all at this point. But what happened with our body cams was we purchased the rest of them in November for our jail staff. So the jail staff wears these body cams. And then in January, or the beginning of February, they told us, the company that we bought these from told us, oh, by the way, we're getting out of the body cam business after we bought $30,000 worth of equipment. So we thought, well, we could stay with this system and hope we get support, or we can move on. So we decided to try to move on.
Okay.
So it's a good system we got that we've chosen. It's just the price tag. It has a lot to do with the integration of the data that we're going to get. It's going to save a lot of time for my deputies. So that's what we're moving towards,
Okay.
but we're just not quite sure on the pricing yet.
Yeah, we'll table it till next Tuesday.
Okay.
Purchase of Cradle Point devices for patrol vehicles.
So, you know that the 4 chiefs, JC Fire, JC Police, myself, and EMS have been talking about enhancing the 911 communications and response. This is part of that conversation that has occurred. Brian brought to my attention about putting Cradle Points in the patrol cars. EMS is already doing this. It's not Cradle Point, but it's the same type. And it enhances their communication with the MDTs as well as some of the phone service that we have. So we would like to move forward with this. And now, since I know nothing else about this on how it works, I'll turn it over to Brian.
So, what the program the sheriff's talking about is referring to is right now at EMS, we have wireless access, cellular data wireless access points in each ambulance, as well as the administrative vehicles. Each one of those vehicles they have 2 different cellular data providers. And the reason why we do that is to keep from having an outage or basically dropping off of the map. So, in particular, out in the rural areas when we're serving the county, when we get out towards the Russellville area and things like that, it seems like Verizon is the carrier that works the best out that direction. So basically, we're looking at providing at least a 90-some%, almost 100% uptime versus when you go with one provider, you run into areas where you don't have service or coverage. And what we found is that where the laptops are good with cellular data cards in them, they're not near as reliable when it comes to the cellular data connectivity as when we put in the cellular data access in the vehicles themselves with the 2 providers. So the sheriff has quotes that are off of cooperative procurement that cover everything but installation.
The other enhancement that this does is, right now, the connectivity that we lose sometimes is our GPS. So sometimes when we lose that connectivity, we don't know where the deputy is. Normally, if ever the connectivity is working good, dispatch knows exactly where our deputies are at. So by enhancing this, by putting the cradle points in there, it will also enhance the GPS capability and also give us routing. So it will actually be able to route our guys too.
And this also goes to, you know, your project moving to your new CAD software.
Right.
Because it is literally internet dependent,
Right.
so.
So, and the total cost for that was how much? I don't remember, Brian.
So the figures I have in front of me are, for the Cradle Points, it was $70,200 for the Cradle Point license. The modem is $20,709. So that's a grand, let's see, and then the antennas are $27,683, and then that's for 39 units. And then you have the Verizon, which is $40 a month per vehicle. So you would take $40 a month times 39, and then that would give you your monthly spend on your additional cellular coverage. And then I think the estimate was $450 installation per vehicle. So I didn't write all that down, but
Of course, this would be a contingency. We'd have to pay this out of contingency on the items and the installation. We don't have to worry about going out to bid. We already have a contract with an entity right now that can do the install.
Well, did I hear everything is covered but the install?
Yes.
Right.
Well, yes, that's correct.
yeah, the
On
number.
that pricing.
Yeah.
But it's not a grant. We'd have to pay.
We're still paying for it.
Yeah.
Oh,
So everything's covered.
Covered.
It's under the state contract, so we don't have to go out to bid, which made Jessica very happy. See, I wanted to include you.
we got a grand total here, Brian?
I'm coming up with it right now.
I can't count that high, Brian, thank you. Eric Coy also supports this program.
Like 256 grand? Are you ciphering there on paper? You need, get him a calculator.
I was just writing the figures down, sir.
The number that I had came up with was 260,000 is what I was gonna go, and just say we're gonna do the transfer 260,000. And then if we needed more or less, I could contact you again. But mainly, I just wanted you to go ahead and greenlight the project so we can move forward with it, because it will take some time to implement this.
So you got that in there, it's in your contingency?
Yes,
Got plenty in there?
yes.
Debbie's not talking to me right
No,
We do have it in there, that we have, what, 8.2 million, I think I can afford to.
I'm not saying nothing about this. I'm still in shock from something else, so.
Okay.
I don't know how we say no to the risk that we take if we don't say yes.
It really does go along with this whole conversation that we've been having about enhancing our response time, enhancing our ability to serve the public.
now. I think it's for
Whoa.
the safety of the officers too.
That-
Yeah, I do
As
too.
much as
It's a
anything.
multitude of reasons why we should do this.
Yeah.
That's where I'm going with it. If you lose contact with the officer because he's on Verizon and we wanted him on another one, and you lose contact with him altogether, you don't know, and you didn't know where he was,
So-
it's just scary as,
And the fourth thing that
Oh.
I would say that this benefits us is, it actually makes the vehicle a hotspot. So if they enable Wi-Fi calling on their cell phone in some of the areas of the county where we don't have cell service, they would still be able to use their phone. So,
Well, and honestly, so we're pretty much the ones that deal with the problems that they're having now. And so something needs to be fixed over there. I mean, I'd be frank with you. I mean, the lack of coverage is a huge concern for me and for them. So, I mean, when you have the two cellular data providers in there, that resolves that. I mean, I've seen it happen at EMS. You know, we put in two cellular data providers, and I think Chief Wood can attest to it that we went from vehicles dropping off of the map and things like that to having almost 100% uptime from a management perspective. So,
Yeah, I mean, when we respond in the county, we don't drop connectivity due to, you know, the actual service. You know, there's times where the equipment needs to be reset or does something funky, but as far as data connectivity on both networks, having that backup is really important. So, you know, you talk about officer locating and all of those sorts of things, but having that ability to have that CAD information and continuously receiving the updates as it's being typed in from the caller is super important. So I know it's a lot of money, but
Well, I'll tell you what, when you're riding along with the deputy at night and you're out somewhere and you've got, you know, your backup can be a while for your backup, but if we lose contact with that deputy, it gets kind of scary when you're,
It's a
you know, when
lonely
the deputy
feeling.
tells you, okay, if something happens, pick up the microphone and say, officer needs assistance, help! I mean, it's kind of scary,
It's a lonely feeling.
yeah.
What do you need from us today?
I think you just need to go ahead and vote and allow me to do this project. I don't necessarily, I don't think I necessarily need need the permission. I would like the vote, just so that I know that I have your support, but it's just a simple transfer that I just bring to you, but like I've told you guys before, I don't like surprises, I know you guys don't. And I wanted to make sure we were above and board about since we're going with all-state contract, we're above and board on notification to you on what we're doing, especially spending that much money.
I'm fine with going forward with it. My numbers were a little skewed because I had included the Verizon, which is gonna be a monthly and ongoing cost, so kind of take that one out. The one-time cost was a little different then, so. But yes, I'm fine with moving forward with it,
I am as well.
so. We just need a motion to approve the purchase of the Cradle Point devices then? Okay, I'll make a motion to approve the purchase of the Cradle Point devices for patrol vehicles.
Second?
All in favor?
Aye.
Thank you.
Just so you know, I booked the 4 chiefs down in Branson. You're gonna do some doo-wop down there during the Christmas program, so.
I got base.
I think the 4 chiefs is a really good name.
I happen to know that I'm a good bass singer and he's a good tenor. So
I was trying to think 3 chiefs and
I
a
don't sing.
kaput, but that didn't, the 4 chiefs, yeah. Okay, do we have anything else before we go into closed session?
Yeah, where are we at on ARPA stuff? Have we gotten any more answers on some stuff that we had requested? Just trying to keep things moving on that. I know we had some people in this morning talking about some of their requests as well, some of the fire districts and stuff, so I'm just trying to get some people some answers.
Well, initially I got one this week. She is going back and revisiting it because she wants to make sure, I wanted to have an answer if it qualifies for both sides of the story, which is under our revenue sharing, the 10 million, and under the 5, if it's different. She did initially come back with one of them that was under the 10 million, which is the first 10 that we sent her to begin with. But she's still looking at now whether the ones that were kind of denied on the first round would fit under the 5 million, or fit under the 10 million, sorry. So she said she should have that shortly. I'm hoping by next week, Tuesday, that I'll have an answer at least on the first 10 that I sent her. And I also did take the initiative to send her all of them that were on the first
Okay,
round of it.
that's what I was gonna ask, because I think had all sent to you that we were all for giving some money towards them, whatever the amounts were, be it different or not, but if we can find out if they qualify.
Right.
So,
Yeah.
okay, great.
And it'd be nice really if we can,
By next Tuesday, we may know whether they fit under the 5 or the 10.
The first 10 of them that I sent you to begin with, we should be able to decide whether they fit under each category.
Okay.
But the rest of them that I just sent will probably not be ready, for next week.
But she has them.
She has them.
All right.
So then maybe the following Tuesday?
Yeah, these came back pretty quick. I mean, within 2 weeks, I would say. Because that's why I was thinking initially only to give her 10 at a time, because I didn't want to overwhelm the system, but they came back pretty quick within 2 weeks.
well, it'd be nice if we could,
Just under the first.
But there's some that are the same under the rest of the list, like the air tanks. You got different districts looking for them, and so some of them are kind of duplicates but different.
Right, if it's a fire district question asked 4 times, you only need one answer because it applies to,
And they are just strictly doing based off of that application. There's
Okay.
not being communication going on with any of those vendors or anything at this point,
okay.
or applicants. So I will push and get that back on the agenda for next week.
thank you.
Yeah, I'd like to see it on the agenda, and if she's got all of them, but maybe 2 of them are a headache or not as black and white,
Yeah.
then let's start addressing them and see where we're at with it.
And I did have the conversation about, still an example of the award letter and, subrecipient agreement. And she did say those were with their legal team, that then it would have to come over here.
Has it got to be different than the first round?
Probably a little bit of different wording
Change some
from the
wording.
CARES versus ARPA versus that.
I don't know, that just doesn't seem that hard to me. I can change some dates and
Well,
acronyms in there.
There's more stipulations on us than there was in CARES because it came through the state versus the state basically mandated. Now it's coming strictly from the feds, so we have to do what they say. So agreement, maybe award letter, maybe.
But we're not the only ones doing this, so we're not the first ones writing a letter. There's got to be other letters out there, so they ought to be able to copy and paste or.
I heard it's with the legal team, so they must have it written. They're just making sure they've got all that.
And if anybody goes
I'm
to
not-
Leavenworth, it'll be the sheriff and our EMS chief, not the commissioners.
No, I'm not blaming this on you or. them. It's
Leavenworth,
just-
they said the food's pretty good.
We're not reinventing the wheels, what I'm getting at, so we ought to be able to get some answers fairly
Yeah.
quick, so, okay, thank you.
All right.
Anything else?
No, sir.
Closed session? Have a motion pursuant to section 610.021 of the revised statutes of Missouri. The commission will go into closed session to discuss the following: legal actions under section 610.021, subsection 1.
Second?
Roll call?
Sam,
Yes.
Harry,
Yes.
Yes.
And for your information, I left my suit coat in my office.
Hey,
I apologize for being so casual
hey,
today.
Ryan's part of the singing group. He'll be backup singer.
Okay.